Hey folks, welcome back to the Change Physician Podcast. This is your host, Dr. Kevin. I'm here today with my co-host, Dr. Melissa Cady, and our guest for today, who is Dr. Cathleen Mok. Dr. Mok is a family physician out in Crown Point, Indiana, who has her own direct primary care practice called Envision Health. And today we're going to talk about her change physician journey, where she started, why she went into medical school, and ultimately the decisions she used to create and begin her direct primary care journey. So, Kathleen, it's so wonderful to have you on the show today.
Well, thank you. Thank you for inviting me.
Absolutely.
And for everybody listening out there, is Cathleen Mok is one of my favorite people. So it just, I'm hoping to keep this pretty low key in this interview here. But I want to go back because I had the privilege of knowing you in medical school, but I don't know if we ever talked about that back in those days. Is why did you actually go into medicine?
You know, it's funny. I was just talking to my sister-in-law about this yesterday. She was writing a book and asked me the very same question. And it sounds so cheesy in a way that like we all go into medicine. At least I thought we all went into medicine because we were going in to help people. And I really did. I mean, it wasn't, there really wasn't a whole lot of financial incentive for me other than to know it was hopefully a stable, profession, which even that these days is debatable. And I kind of decided to do medicine later than I think most people did, because I had no physicians in my family. I only found out after becoming an adult that my grandmother was actually a nurse, which I didn't know because she wasn't a nurse during the time I knew her. And I went in, the actual college I went to was the only place I applied to pre-med. So junior year of college, I remember the pre-med advisor saying to me, well, are you going to do this or what? I said, I have no idea. I don't know. I mean, I just wanted to do science. I didn't. So I spent some time volunteering. I actually went to Boston University. So I went to a hospital in Boston City Hospital, and volunteered in this immunodeficiency clinic. And my world was forever changed. I loved every second of it, and still have such vivid memories of my experience there that I knew this was what I was meant to do, so the rest was history after that.
What was it in that immunodeficiency experience that really, I guess, appealed to you?
I really, it was such an underserved community that we worked with. And the nurses and doctors really allowed me to get in and actually just really talk with the patients. And it wasn't as much the medicine exposure as it was that relationship that you hopefully develop as a physician with your patient. And there was one particular patient I remember who came in, and it was an outpatient clinic. It was, we did have the ability to admit to the hospital, but mostly we were seeing outpatient. And I remember one gentleman in particular, and I was literally just telling the story yesterday. It's so crazy that, I remember everything about him, and the day that he came in that he wasn't well, and I was the one who ruled him over to get admitted. And I had met him several times, so it wasn't like we didn't already have some of a relationship, and just not realizing at that time that was the last time I was ever going to see him. And just coming back after a break from college or whatever to go and volunteer again, to find out that he had passed away. And just that feeling of, I think it's like probably when we all lose our first patient, and it was just like, so it was probably one of the strongest emotions that I had at that time, because I was just so taken by this gentleman and his story and where he had been. And then now, if you think, 10, 15 years later, if he had been around, he probably would be still doing fine with, the advances that have been made in that field. But it was a wonderful experience, and I'm forever changed because of it. So
Yeah.
Well, that's sort of, you had a very early exposure to that awesome responsibility of being a physician. Like, you know, people like to talk a lot about, you know, what medicine is or whatever, but until you're a physician and you have somebody's life in your hands like that, and you're responsible. And again, you were just exposed to that decision-making process of seeing the patient over time and then having to take them into the hospital. But really, as a physician, just what you were talking about made me think about that when the first time one of my patients passed, or the first time that I ever had to, you know, like stop someone on a ventilator. I mean, that was, I'm getting emotional now just thinking about it. But
yeah,
you know, kind of returning your journey. Now you have that experience and you go into medical school. So you have this expectation of helping people, which I agree with you. That's why I went into medicine. And I think there's many of us do. And it's funny that we think, oh, this is kind of cheesy.
yeah.
But is it really that we go into a career because we want to help people? You know,
I know, but I feel like the people that interview you, they like want some really like deep, you know, story, and you know, sometimes it really comes down to just that, you know.
Yeah, and I think that moment gave you that opportunity to recognize how good it feels to be that partner in that journey. I think that's incredibly powerful too. Yeah.
Absolutely. So then you enter medical school. You've got this idealism and you go into it. And what were your experiences during your medical school experience?
Oh, just the first 2 years are always tough, right? I know, I realized, you know, when you're in with a bunch of super smart people that, you know, you may be just averagely smart, but you still come out with the same degree as that super smart person. It was a challenge, at least for the studying part. But then when you I felt like I came back to life my third year, when you actually got to get back out and experience medicine, as opposed to just sitting there looking at a anatomy textbook, you know. It just rejuvenated for me that desire that, okay, yeah, this is it. This is why I did this. This is awesome, you know. Even the long hours or the long call, or just, I mean, you almost get revved up by it, because you have this long night on call, and you can reflect back on later on that you know, I did I had a code on somebody, or I delivered a baby here, or I, you know, thankfully this person came to the hospital and is gonna live another day. You know, it's incredible. I mean, when you think back over it, it's amazing.
Yeah, there's some real timestamps, I think, that we, you know, even like Kevin was referencing, like when you have to take, you know, someone off the ventilator, or just, there's these really serious moments that they're like very colorful in your mind when you look back on that, and really has an impact, I think, on our being. I'm curious, when you're going through all that training, did you have kind of a predilection or a preference for a particular specialty from the get-go, or were you kind of enamored by a lot of things just because the learning, you know, is exciting, or what did you think?
I think that from that initial experience, I thought that I liked, you know, infectious disease, and I was, even through the first 2 years, was intrigued by that field. And it was funny because we kind of brushed over the topic of trying to get into medical school. But when I was first applying, I applied to a different school than the school that I actually went to. And they saw that experience and said, you know, we want primary care docs. I mean, why would we want to take you? And I kind of laugh now, looking, you know, here I am, primary care doc. But it's so I think coming in, you had that experience, and you're kind of like, well, I guess I kind of like this. But then I do peds, and I loved that. And then knew I didn't want to do surgery. Okay, let's get that right. I love my fellow surgeons, but I did not want to stand in an OR for a long time. I don't know how anesthesiologists do it, but
with a heated vest.
yeah, that's the problem. I was always freezing. So, when it came down to deciding, at that time, I was dating somebody who was a few years ahead of me in school, and I said, oh, I really love peds, and and he kept saying, if you're a female, you'll normally attract, women and children. So you could do family medicine and do a lot of different things. And I'm super glad that he kind of, he didn't push me into that direction. This is, of course, now my husband. But he was also, being trained to be a family physician. And now I look at it as it's just so open to, you could do anything. You really could. You could really have a niche and just do that, or you could do everything, so.
I want to hold on to that. And
Okay.
because I want to return to that, which I think is really crucial when we talk about primary care in the future. But I want to move now into, so you then decided to do family and you went into residency. Did your views about why you went into medicine now, as you're moving into residency and kind of gone through this, had that changed? Did you ever feel the moment of like, why did I do this? Or did that not occur to you?
I think when you get tired enough, that thought crosses your mind. But I was always pretty pumped up. I did a rotating internship. So I did a lot more inpatient my first year, and I think it kind of convinced me that maybe I'm not as much of in love with the hospital medicine, but I certainly got a good exposure to that. I still, what kind of always pushed me along is I've really enjoyed the challenge, and I liked having people around me that could kind of help build my knowledge, because I always had, my first year of residency, there were so many residents around, and it was just amazing how much I almost wish I could go back to just being able to pick up some of that information again, because I think you're just so sleep deprived. I don't know if you really pick up as much as you possibly could. And don't get me wrong, I wouldn't want to do those hours again, but so I guess that does beat a little bit out of you. And then, but I switched. So my second and third year, I went to an unopposed program. So the family med residents were the only ones that were there. So they, went from just having so many residents around between OB and surgery and family and internal medicine, and to only us. And I liked that. I liked having a more, I don't know, just less crazy going on. It was still a pretty decently busy hospital and residency program, but it was more my style of like, okay, if I'm going to do this, I want to be able to have my hands on doing the OB, or hands on doing the, if there was a surgical procedure I wanted to do or something like that. It just allowed me to have more of that exposure. And, I think it better prepared me for when I came out into practice. So
Different type of responsibility, really, between learning with.
I don't know if I really got at what you were asking me about, but
no, but it sounds like you were never saying, even during residency, like, I should not have done medicine.
No, and I think and I don't know if I'm getting ahead of you, it's that I think my career choice decisions changed a lot more after I went into practice. And I think that was where the biggest issue was, where I went into a hospital run family, well, it was a multi-specialty office. And started off just being, a new graduate, but I had a newborn, and, trying to figure out how to balance it all. So I think that around that time is where I started to wonder, am I in the right field, or am I doing the right thing?
What was it about that shift? What was it you were noticing about your new experience that was troubling?
So, I think I had a late decision again. Remember, of deciding to become a doctor. I always knew I wanted to be a mom. So here I had a son, and I want to be able to be part of that. And then when we got pregnant again a couple years later, I was like, okay, I want to be part of their lives. So this is becoming difficult, and it was trying to negotiate being able to be a working, mom,
Mm-hmm.
physician, and be a mom at home and be able to be in their lives and them to know me. So that was the real shift, was when I had kids.
Yeah. It sounds like there wasn't a lot of flexibility or adaptability to that at all in that environment.
No. And I asked for that. I actually, I came in so new, and my, our son was like 9 months or something when I started my job, and he had gone to daycare from like 11 weeks old or something. So we had a good rhythm with him. And then I knew, once we added another one to the mix, I said, this isn't going to work, because I can't do this and be a mom. And I said, I feel like I would be fine if I had just the outpatient, and I asked for someone to take my hospital work, because it wasn't something, like I mentioned earlier, it just wasn't something I thrived on.
Mm-hmm.
I really liked the outpatient setting, and they weren't willing to, they just started getting their hospitalist system going, and they weren't willing to have that. So it was a deal breaker. I left.
Wow.
So when you moved to your other practice and location, did you find, I guess I'm kind of moving towards, is you went through medical school, you go through residency, everything is going, and then you get into the actual practice environment, and now you find this inflexibility when it comes to where it sounds like you were willing to trade off and negotiate, but then the system was like, no, you have to do this, and now there's this rigid inflexibility. Did you find, was your new practice more open, or did you still find evidence of kind of this inflexible, you're the physician and actually you're our little cog, and you're gonna do what we want you to do? Or
yeah, so I actually left family medicine and went into occupational medicine. I mean, I was lucky to have I kind of fell into the position because my husband was kind of forced into that position from the kind of same hospital system, and it was a perfect fit for him. And I knew the people, I knew his boss, and I needed a job to at least pay my loans. and I decided, you know what, I want to be part-time. I want to be able to be home with my kids. I want still some exposure to medicine, and it actually was a huge chance to learn a new skill, and they were so supportive. I could never have I still spend a day a week with them, so it's been like 10 years of me of having something that they were always very flexible and willing to, if something happened and I needed to go get the kids because one of them was sick, I could always do that. It ended up being a perfect situation.
So how long were you doing, you said 10 years. you were doing this occupational medicine, but is there something now that's different, that you said you just started in January? Is that where the shift was from the occupational medicine?
So I obviously decided I wanted to be a family physician, right? And I only spent 3 years really doing, and yet I still run into patients all around town that were my patients during that time. And they would say to me, well, when are you getting back to doing family medicine? I said, someday, and it really came down to when I felt like my kids were, it's not that they need me less, it's just that I can still do family medicine like I want to do and still be able to be there for them. And I guess it was probably about 2 or 3 years ago, I started to feel like, like this job is okay, but it's just not fulfilling. Like I said, it helped me pay what I needed to pay. It helped teach me a whole lot of new skills, but it wasn't the challenge of family medicine, which is, having that patient that, you're just trying to help on the way to the best patient they can be, type of thing, So I had about a little over a year ago, I was at a conference, and I listened to a doc who is down in Texas speak about direct primary care. And I had been keeping a journal, and like, it's so weird. Like, I brought this journal with me, and I was like, well, I didn't even know this existed. And there are people that have been doing direct primary care for 10, 11, 12 years, and I didn't even know it existed. And I said, this is what I want to do. I want to be able to take care of patients without administration, without insurance companies, without drug companies, and all these other things telling me how I need to take care of my patient. I want to take care of a patient like I was trained to take care of a patient, and do it without all that burden of billing insurances, and really offering to patients something that is really a great option for someone who doesn't have insurance, or maybe has insurance but just doesn't go see a doctor because they, the moment they walk in the door, there's this huge bill that they see 6 months later, and they can't afford that. So it really, I couldn't have found a better place for me. So
yeah, I find that interesting is you're like, because they're different. Occupational medicine and family are definitely very different.
Yes.
In what we would call focus of care. And so it's interesting, you're finding this not so fulfilling, and then you're journaling, and then all of a sudden you walk into a conference event and you hear somebody talking about it. It's like, hey, wait a second, that's what I'm writing about in my journal, and you're already doing it.
Yeah.
So and I wanted to circle this back to this discussion of primary care when you're in medical school, right? When you're looking at all these different options, and then your husband Charlie is like, well, family does that, family does that, family does that. Mm-hmm. And the reason I want to bring that up is so often we hear how burned out primary care is, and yet when you look at this particular option, which I'm going to ask you a little bit more about details about direct primary care and practices, though, it's a perfect fit for the right-minded primary care physician. Mm-hmm. And this is where most specialists, being a specialist, this is not a great option for a lot of specialists. And I mean, there's ones that are doing it, but yeah. I would say it's a perfect fit for primary care. And so could you kind of, so your practice is newer, it's about 6 months old now, mm-hmm. But with that, why did you choose primary care? What were those first decisions that you were making? Like when you were trying to open your practice, how did you actually commit to doing it? And what were the first couple action steps that you did?
So, well, once I left that conference, I was so pumped up. I was so excited to find something that I could actually do what I wanted to do and not have to worry about I mean, you figure when you're out of something for 10 years, how am I going to go in and learn all these codes and all these things that, these metrics and all these things that you had? I'm like, I'm never going to be able to get back into this. And all of a sudden this was an option. So I think I even have the journal with me today. I think I went and I like planned out and tried to figure out how much time I really needed. And that was one of the talks, that was what she was talking about, is like, you can do this. What do you need to do? And, you know, they talk about making a plan, a financial plan, and, you know, just trying to get your mind around where you want to be and when you want to do it. And I literally, that was March, I think, and I think I had already started looking at locations toward the middle to end of summer. So August, I told my boss, I'm like, hey, this is what I'm thinking about doing. So it was a pretty fast turnaround. You know, I reached out to my cousin who was a business guy and asked him if he'd help me with my financial plan and what I needed to do, and just started doing it. I mean, I used that whole year to really save up as much as I could. I had been put into a new role that had actually raised my salary. So I was like, oh, I'm just gonna take and put all that money away. And I actually never took a loan out. I just kind of started just putting money aside that I could use for, you know, just a small spot. So I guess in, you know, August, I told my boss. In October, I had a place, and January 2nd, I had an office. So I don't know if that's what you're getting at, but it was a really quick turnaround. And I'll have to, huge shout out to all the DPC docs, because they are just so open and sharing of their success and their and they are so happy with what they're doing that they really want more people to do it. Because I think people in private practice, it's hard in a hospital system, but in private practice it's like even harder. And this is a system where we all are so helpful with each other, in terms of just how to do it and what you need to do, and, you know, making sure you're on this so that you can order these things, and opting out of this, and all these other processes that you have to do. And there's just so much help within the group that it's just awesome.
Yeah, I think there's something to say about feeling a sense of community and support. And I think we all feel when we have a challenge, it seems a little bit overwhelming sometimes, just having that, you know, those little things you need to do makes you feel like you can do it. And then you're seeing all these other people doing it. And I think there's something about bringing the joy back into medicine when you have people that are starting to really live that dream. And I've met several people that do what you are doing, and it's a game changer.
Yeah, I mean, it's amazing, because I just never even thought this was a possibility. And to think that, you know, I don't have a nurse, I don't have a secretary, I have me. So I do it all. I do all my own everything, ordering, you know, all the things that you had all these little people for, and you never realized like how much help they gave you. I was just thinking the other day, I have to order this test. I'm gonna have to call that lab and find out like exactly what I'm supposed to do it, because I don't know, but I can find that out. And it's awesome. You know, it's a lot of pressure, but it's rewarding at the same time at the end of the day to go, wow, like yesterday I was actually a really busy day, and I said, wow, I felt like a real doctor today.
It's like being a resident again. You did everything.
Yeah, I mean, I'm like, yeah, really. And I don't know. My husband's like, you've been a real doctor for a long time. Like, yeah, but like really, like I felt it felt like a good accomplishment getting to the day, and everybody did well. So.
Well, and if we go back to where you started, you go into medicine, or you pick medicine to help people. And, so much of what we see is the system itself is not necessarily, that's not the goal of the system, really. The system is how can we build people, and how can we make sure we build them for more, and how can we do this? And so it's just interesting, because you physicians have a skill set that an administrator doesn't have, that any of these other hospital people don't have. And I'm just always like, instead of being told, well, I'm stuck here, I can't do this, I can't do this, I can't do this, it's just like, well, you just have to open up your eyes a little bit. Like, you already had ideas of how an ideal practice would work for you, and lo and behold, you discover that people are doing it.
and I add my own little tweak, because I have acupuncture piece to it too, because my old boss was kind enough to let me work and build this practice, pretty much, that we never really advertised, and I ended up being able to bring with me to my own office. So now I have my primary care piece, which I had been longing to have, and my acupuncture patients, who have now become my members of my practice as well. So I can do both and really help people, which was what I wanted to do. So.
Oh, fancy.
Yeah.
I don't know if there's a specific, I know you journal. Is there a specific resource other than obviously your DPC community? Is there like a book or a resource you find very helpful, or has impacted you in just changing your life or perspective as a physician?
I wish I could say I'm a better reader than I am. So the books I've been reading,
medical.
Yeah, I know, it just kills that whole desire. The books I've been reading have been written by other DPC docs that have been kind of like rock stars. So I'm trying to learn a little bit more from them. One of them is super good at like marketing, so I've been looking at that.
Yeah.
And I can't say, and I mean, I know you said it's not the DPC community, but I can't say enough about how supportive they all are. And just when I think I've touched on most of the resources, there's another resource out there. And that's what I'm working on right now, is just this newest book that one of the docs put out. And that's the beauty of it, is like, they're putting out these books to like let the rest of us they already worked through all the details, all the hard part, and you can just like basically use all of the tricks they've learned to be able to be successful. And it's like makes it so much easier for the rest of us. And I think I've tried to tell even some of my colleagues in town, like, this is the way to go. And there's some negative kind of thoughts on it, because they get it mixed up with what like a concierge type of medicine, which it's really not. I mean, we're really giving care for pennies when you think about it. And it's about that relationship that you build with that patient, which goes back to that first patient I ever had. That connection is so key. And I just don't think the traditional fee-for-service model is really fosters that.
Yeah. I'd like to point out two things there. This idea of, first of all, the community and the books that they put out, and really, if we're wanting to move in a different direction in our life, having someone who's done it before and is a guide, that is critical for a lot of people's success. I mean, a lot of people, even athletes, they get someone else to coach them. They want someone else's perspective and some guidance, but you the second thing is just you've created this transparency and the value. People are directly transacting with you because of the value you provide without this curtain of, or lack of transparency from third-party payers and some of the deceptive things that go on with pharma and whatnot. So I think, that's where it's at, is people just want to know what they're getting. And when they love you for what you do, they're going to pay you. And, even if the, COVID-19 and the pandemic is going on,
Yeah.
even if they they want to support you, they want, because I think that's what most people, when they finally get it and they see it, they want it, and they're going to support you all the way through. So congrats on doing what you did. The transitions aren't always easy.
Yeah. Thank you so much.
Yeah.
I wanted to also add, kind of, again, with this primary care and direct primary care, we probably don't have enough time to really discuss the differences between, say, a DPC model and concierge per se. But I'm going to ask you about where would you recommend a physician, really a primary care physician, who's wanting to kind of escape that rat race and wants to help people in a low friction environment where it's, you don't have all those other people around to get involved. Where would you point them to say where this is the one resources I would tell them to get more information for now?
I would, I'd probably say the first thing I ended up doing is going to the DPC summit that they have every year. It's virtual this year, and they can sign up through, I believe, the AAFP. I think they can sign up through probably our DPC Alliance group too. I'm not positive on that, but I can't say enough about it's a shame actually that it's virtual this year, because I think, I literally think that the number of DPC docs is probably it was going up, and I swear it did this last year, because I can't tell you how many I've seen even on our Facebook group, and people can reach out to me, or there's there are certain people on the group that can add docs, so you can kind of see the community and see if it's something that you're interested in. It is such a supportive environment and supportive group that I don't know how you wouldn't want to join it. And I mean, you have to have the desire to want to do this sort of direction in medicine. But at this point, how nice to know that you can control your hours, control the number of patients you see in a day, control how you handle anything. And it's, you really need that, because it's scary. I mean, what's been going on? I mean, it's nice to have a little bit of control over your own safety,
Mm-hmm. No, and that's an interesting point too, is so much of what we lament in medicine is lack of control and loss of control, and why we can't make the decisions that we want to make anymore. And that's not the case. We can always make the decisions. The choices that we have as physicians is how do you want to go in an environment where you can choose to take control again? So,
right.
So I just thank you so much for coming on the show today, because I think it's so important that more people hear about these options that people have, that you have this medical background. You can construct a practice that works, or you can construct a physician life that works for you. It just takes some awareness of what's out there, and then some choice to encourage to pursue something different. So thank you so much for coming on the show today.
Thanks for having me.
Thank you. And thank you all for joining the Change Physician podcast, and we will see you next time.